Hello, and welcome to Ontario, Canada. If you're a newcomer, there must be many things on your mind, but for today, we'll be focusing on accessing healthcare services in Ontario for refugee claimants, convention refugees, protected persons, or humanitarian cases. If you've made a claim for refugee status, whether at an airport or inland immigration office, you should have received your refugee claimant identification. Your refugee claimant ID, or an acknowledgement of claims document, can act as your health coverage. As a refugee claimant, you are covered under the Interim Federal Health Plan, or IFHP. IFHP provides you with comprehensive medical coverage such as doctor and nurse visits, diagnostic and laboratory tests, orthotics, and other medical devices. IFHP also covers medical dental services, basic vision care, including eye exam and glasses, and allied health services such as physical therapy. Most prescription medications are covered by IFHP, and the coverage is similar to recipients of social assistance in Ontario. For these particular services, please first check with IFHP for approval. With that said, in Ontario, where can you go for healthcare services? Firstly, you can visit a family doctor. A family doctor is someone you would see regularly for your care. You can contact your local doctor's office to find out if they're currently accepting new patients. Secondly, you can also go to a walk-in clinic if you don't have access to a family doctor. Walk-in clinic doctors won't know your medical history and will typically see you for your urgent problems. Thirdly, you can also see a specialist, for example a cardiologist. However, in Ontario, you cannot go directly to a specialist. You must first go to a family doctor and have them refer you to the specialist. Not all clinics accept IFHP, so it is helpful to call the clinic before you go to ensure that they accept you. When you go to any clinic, hospital, pharmacy, laboratory, or other medical facility, you must bring your brown paper or the acknowledgement of claims document. Some clinics might only accept the original brown paper. Additionally, if you have any emergency, you can go to an emergency department of a hospital. And lastly, you can also find a family doctor in a community health center. They might also offer a range of services including primary health care and health promotions and counseling. Your IFHP does not last forever. After your refugee hearing date, you will receive either a positive or negative response. If you receive a positive response, you are no longer a claimant, but a convention refugee, a protected person, or accepted under humanitarian and compassion grounds. This means that you are now covered by the Ontario Health Insurance Plan, also known as OHIP. You have 45 days to go to a Service Ontario office to get your Ontario health card. Until you receive your health card, your IFHP will still be functional, but do not wait too long. If you receive a negative response in your refugee case, your IFHP will still work until the date of removal from Canada to your country. If your health coverage expires for any other reason, you can apply for a renewal of your health coverage. To find more information, please go to settlement.org/ontario/health/refugee-health. This website will provide you with additional resources about your health coverage. Thank you for watching, and we hope you have a better understanding on how to access healthcare services in Ontario.